And what will be so unique about that bacterial vaginosis? For the discharge fluid, it will be greenish, okay? And on top of that, it will be fishy smelling, okay? It will be like fish, the rotten fish. So now it is bacterial vaginosis which is suspected, okay? So, and I want you to know that if at all no intervention has been done on most of these infections, they can now complicate, and we should always prevent those complications. For example, men in women, we see that some of those microorganisms, they can now infect or they can affect their useful organs, okay? For example, it can infect the Bartholin in females. The Bartholin gland, it is responsible for the production of those vaginal secretions that help those women during the sexual intercourse for lubrication. And the microorganism responsible for causing that is Neisseria gonorrhoeae, which causes gonorrhea. It will cause the inflammation of those Bartholin glands, which can result into what we call the Bartholin cyst, if at all pus is formed within those Bartholins, the Bartholin glands, okay? Now the intervention at that stage to be to remove that gland, okay? Now it means its function will now no longer be performed, okay? Still, if at all no intervention has been done, these infections, they can now ascend to infect those organs which are high, okay? Because now it will ascend from the vagina, it ascends now to the cervix, okay? And if at all it infects the cervix, now the results into what we call the cervicitis, okay? However, there are also other causes of cervicitis, or the inflammation of the cervix. It can be CA of the cervix or cancer of the cervix. They can be tumors, okay? The wandering tumors. But these infections, they can also cause the inflammation of the cervix, mainly the gonorrhea. It can cause cervicitis. And they normally present with painful sexual intercourse, females. Then for me, I will ask them, actually I normally ask them, do you feel pain on superficial penetration or on deep penetration? And they normally complain, like myself, I feel pain on deep penetration or when the man is inside, okay? So for me, I suspect now it could be cervicitis, or the cervix is now inflamed. And when I try to visualize the cervix using the spatula, I will always find it is oedematous and inflamed, okay? So if no intervention has been done, now those infections, they can ascend now to infect the uterus, the fallopian tubes, which result into the inflammation of those tubes, the salpingitis. And we know it is